So let's just get back, if we can now, and talk about medical malpractice and some of the sort of sub areas that we work on. And one of the areas which are very serious and that we do and have done many cases, Amanda, comes in the area of misdiagnosis of cancer.
Right. Failure to diagnose, misdiagnosis. Yes.
So you have a failure to diagnose or a misdiagnosis. And cancer cases, of course, folks, can be devastating. They can be devastating because depending on the type of cancer, it can be life-threatening or life-changing. And so how do we assess that kind of a case? What do we do? And so we're going to talk about that today. Amanda's handled many of those cases with me. We screen those cases very, very carefully. We listen to the stories. And, the stories can be heart-wrenching at times. And we're here for you. So if you have a situation where you believe you or your family member has been misdiagnosed or was not diagnosed for some type of a cancer, and you believe that it caused injury and or hopefully and terribly, I should say, death, please give us a call too. And we'll take our time. We'll listen to it. Doesn't mean simply because there is cancer that automatically somebody has committed malpractice. Fortunately, most of the doctors, have not and don't, right? But there are many cases, unfortunately, where there is a misdiagnosis or a failure to diagnosis, and it's devastating. Absolutely devastating. And so with those cases, we look at them differently and we have to assess them differently. And so we're going to talk a little bit today about how we approach those. What happens when a client comes in? Amanda does an amazing job screening them. Amanda's a person that has a heart. So when you have a person who has a heart, you really have one step up on everything because you have to take the time. Right, Amanda?
Yeah, I mean, like I said, it's a pretty complex process, whether it's going through the records, talking to the client, figuring out and speaking with the experts and figuring out what the departures are. It's a lot to do. And like you said, you have to have the heart in it.
Right. And so we are here for you folks and for any other type of personal injury matters that you might have. It really is our privilege to do them. It's our privilege to represent you. It's our privilege to try to get you justice. So, Amanda, let's get back to what we were talking about. We were talking about misdiagnosis of cancer and failure to diagnose.
Right.
And so when we're talking about cancer, Amanda, there's various types of cancer misdiagnosis or failure to diagnose cases that we've handled, right?
Yeah, I mean, we've kind of handled the whole gamut of cancer cases. But what's interesting specifically about cancer cases is that the statute for medical malpractice is normally 2.5 years. But recently in, I believe, 2018, the law changed where there's now a 7-year full statute of limitations for discovery of cancer because oftentimes we don't discover it until later, as you know.
And I think that was for once, you look at it and say, did the legislature step up and really make a difference, right?
Right.
And I have to give kudos to the legislators where they realized that just wasn't fair because what could happen would be you'd be treating with a doctor and maybe you stop treating with the doctor or a medical provider and there would be an indication to that doctor, or should have been an indication that you had some type of cancer and they didn't diagnose it. And in the old days, you really were out of luck unless you were continuing to treat with that doctor. Is really the only exception. It was called a continuing treatment doctrine.
Right.
So if your care ended and 2.5 years went by and you had that ticking time bomb inside of you and then you discovered it after the 2.5 years, you're out of luck.
Right.
Statute of limitations ran, you couldn't do it. Very different now. Now, from when you reasonably should have discovered it, there's a statute of limitations that extends that 7 years from when you reasonably should have discovered it.
Right.
So we have cases like that. We've had lung cancer cases like that. We've had various types of cancers, kidney cancer cases. The reality is that these are unique cases and they have tremendous repercussions. If somebody doesn't diagnose you potentially, let's say, with a hernia, it may and it can be catastrophic. But oftentimes it's not going to be catastrophic. You're going to be in pain. It's going to be something that you're going to have to deal with, and it's not certainly something that you should have had to deal with. but it's not life-ending or changing.
Right.
In a cancer case, when we get these cases, and sometimes they break your heart.
Yeah, I mean, like you said, kind of every cancer is unique. So the fact that one cancer may metastasize really quickly and take over very quickly is very important to these cases as well. Because again, every type of cancer is different. Ovarian cancer is different from kidney cancer, is different from lung cancer. So I find them to be very fascinating cases. But, it does require a lot of work.
Yeah. And, when the case comes into us, when we're first analyzing it, so, well, it was a misdiagnosis of cancer. Somebody will come to us. Well, we have to make sure, well, was it really cancer?
Right.
Okay. Or was it not? Okay. Someone could think that it might be, but was it or wasn't it? And then we have to first look at those records. We have to know that. Then we have to see, well, what type of cancer was it? Mm-hmm. And all right, the next question is, and as we said earlier today, is, well, okay, let's say someone misses it. Mm-hmm. There's still a question of what?
Damages.
Right. So is there a connection between that failure to diagnose or that misdiagnosis and ultimately what your injuries are and what the ultimate result is?
Right. And I think sometimes in these cases, it can be tough because let's say you have a slow growing cancer and, it would have been the same had they diagnosed it 3 months earlier as when they diagnosed it then. It's hard to then tell someone, well, the damages aspect isn't really there. But
Right.
there are other cases where it's an aggressive cancer and 1 or 2 months can mean a lifetime.
So what we do is we go with truth from beginning to end. We respect our clients, and we respect the fact that when they come to us and they have potentially a life-changing situation or a life-altering situation, we're going to give you the truth.
Exactly.
Okay. And we'll tell you that, well, we have to analyze it. We have to look at it. We have to have our experts look at it. We have to see specifically what type of cancer cells there were.
Yep.
Okay. How fast does this cancer grow? And if it's a cancer that otherwise they should have A, discovered, and B, if they did discover that there would be much different treatment or a much different result, those are cases that we're able to do.
Yes.
And so every case is different. But what we're not going to do is we're not going to tell you when you come in on day one what the case is, because we really don't know. Okay. We haven't analyzed the cellular structure of it. We haven't talked to our expert and say, all right, what type of cell is this? And how long would it have taken for it to get to a certain stage?
Right.
And when would it have been different? That's the reason why we have to go to our experts. We have to talk to them about it. And we have open discussions with you folks, because you've now felt, rightfully so, if you've been misdiagnosed, there's a failure to diagnose, that you've been mistreated.
Right.
And that you really are deserving of someone to be honest with you, someone to listen to you, someone to certainly have empathy and sympathy with you, but someone's going to tell you the truth. And I never found it useful where somebody comes to you and they have some type of life-altering situation or changing situation, and now you're just sort of telling them maybe what you think their itching ears want to hear.
Right.
That doesn't accomplish anything, and you're entitled to more than that and better than that. So if you think you have a case and you're not sure, give us a call. We'll take the time on the phone with you either way. And our hope would be that at the end of it, that you're able to make a recovery and get through the process. Even if you can make a recovery and go through it, it still doesn't mean that there's not a case. There are some significant cases we have where a person now has to go through very, very aggressive treatment, Amanda, versus what they'd otherwise have.
Right. Sometimes they need aggressive surgery. Sometimes the cancer spread to other areas of the body that it wouldn't otherwise have. So we have a lot of cases like that. And if you are someone you care about, if your loved one has been failed to be diagnosed or misdiagnosed with cancer, please give us a call at 631-654-4900. We would be privileged to represent you.
And, you may or may not know it if it's a relative and it's somebody who really isn't able to speak, and you're able to speak on their behalf and they give you the okay to do that. You can call us too, because sometimes when people are going through treatment, they need someone else advocating for them. So as long as they have your permission, And, we'd assure of that. We'd be glad to speak to you also. A lot of times it comes to us in the form of a relative.
Yes.
It's a child or somebody close to you. So please reach out to us. We'd love to be able to help you, love to be able to get you justice. Okay.